and welcome to my YouTube channel. So there is this video that is trending online, very viral video on TikTok, and the clip shows a woman in active labor. Clearly she's in a lot of pain, and a nurse who stays completely neutral, showing no empathy or emotions in her reactions to the patient. So some people have described this as a racist behavior, and others have said the patient and family should sue. But let's talk about it. Now, what happens? The woman is in labor, she's screaming, she's breathing. The nurse is calmly interviewing her and asking questions, apparently going through a registration process or some sort of assessment on her computer. You can really see the way she's focused, yeah. So there is almost no visible emotions, you know, no reassurance, no comforting words, no sense of urgency, and at least from the clip, you can also see that there is some form of neglect or not no form of empathy. So several viewers feel that there's a behavioral detachment, which I also see as well. But let's also look at why this problem persists. Um, there it's some form of silence, and this actually shows that there is lack of emotional support, so this can create a feeling of neglect. In obstructive care, we have what we call respectful maternity care that comes with a lot of empathy and interaction with the patient. So we value interaction with the patient and empathetic behavior, to get quality respectful maternity care. So we also have to understand that nurses do a lot of emotional work, right? So they need to balance their professional and empathetic output. But when they lean too far, like in this situation, apparently, we can see some emotional neutrality or detachment, and the patient may feel like they are unseen. So we have to understand that health workers have this responsibility to treat patients with dignity and care. And when you ignore your patients, it becomes like a form of emotional distress and can bother them. And that feeling of neglect actually comes in. So some studies have actually shown that this kind of silent neglect may be seen as obstetric violence. It's not an overt abuse, but there is an emotional distance, and this distance itself can really harm the patient. So my final thought on this video is that it's a sharp reminder that it's not enough to just do a task as a healthcare professional. So care must include, it must come from the heart. Silence may mean detachment and have a real power to um, on the patient, and it shapes people's experiences and shapes the trust they build in the healthcare system or in the profession. So if you want more real world breakdowns, you want to understand what goes wrong and what could happen, hit the subscribe buttons. Here we tackle tough moments in care and we learn and advocate. Ciao.